Hi, I'm Dr. Fernandez, one of the anesthesiologists at Meadville Medical Center with Anesthesia Consultants of Meadville. I've been asked to tell you a little bit about anesthesia, so I'll make it very broad, just talking about what to expect when you see your anesthesiologist, what our role is, what we would like to know about you, and also hope to answer any questions that you might have about what to expect from your anesthetic and your anesthetic experience. No matter what procedure you come in for, you're going to have an anesthesiologist be involved in your anesthetic care. No one anesthetic fits all. There's no one specific technique. In fact, I know our techniques are kind of complicated and balanced, but our job is to make your job easy. We want to make you back to your baseline status after your procedure. That might require a lot of work. That might require a little bit of work. So we need to get to know you, and that's the purpose of the pre-anesthesia visit. If we have the luxury, we'd like to see you beforehand, depending on your procedure. If you have a complicated medical history, you might imagine we might want to know a little bit more about you, especially if it's going to be a complicated procedure. We've given your surgeon some guidelines as to what we would like to know if you have certain conditions. It might be a good idea for us to see you beforehand. And we have a pre-anesthesia clinic that we can try to do that, to get any tests, find out what medications that you're on, any allergies that you might have before your procedure, so we can come up with some guidelines as to what we may want you to take or not take on the day of your procedure. Even if you were to just come in as an emergency, we would still evaluate you before you had your anesthetic. Some main things we want to know is just to verify your identity, verify the procedure that we're going to do. If it's a procedure that involves one or more extremities, make sure that we all agree on the correct extremity. So we have lots of checks and balances to make sure that your experience is as safe as can be. Other things we want to do is know about your concurrent medications. If you're an emergency procedure, we want to determine the last time you had anything to eat or drink. We want to avoid what's something called aspiration, any stomach contents getting to your lungs. If you're not an emergency procedure, we'll already give you that advice. Usually you're instructed not to have anything to eat or drink after midnight, except for any medications which we may or may not want you to take. And the main reason is because of that. We want to avoid aspiration, any stomach contents getting into your lungs. And usually that's for any procedure. However, emergency procedures, it's different. But if you get, what we want to try to do is to avoid cancellation of your procedure, especially for an elective procedure. We want to have all the workup done before you come to see us. We want to make it as efficient as possible on the day of your procedure, that we see you, we can evaluate you, and go right to surgery without any further workup. Chances are you may have already had a workup from your primary care doctor. Your doctor may have already done EKGs, chest x-rays, and other things to know about you. When we see you, it'll be the first time that we see you, so we want to try to get all that information which someone has already done and have it available to us so that we can quickly evaluate you and do your procedure as safely as possible. For depending on the procedure, it will depend on what type of anesthetic you might have. Some procedures are general anesthesia, where you're asleep and unconscious completely for it. Other procedures are IV sedations, where we give you medicine for sedation. You're never going to be on a breathing machine or ventilator, although we always have that on standby for any type procedure. And but sometimes your experience may be that you're out completely for it. Your experience may be that you thought you were under general anesthesia because you don't even know that the doctor has started with the procedure. Examples of some of those procedures where there's IV sedation, where your experience is that you're out, or typically endoscopic procedures, gastroenterology procedures like colonoscopies, endoscopies. Even though you're not under general anesthesia, you're not on a breathing machine or ventilator, your experience will be that you're asleep completely for it. Other procedures, such as procedures, removals of simple cysts from skin, wrist cysts, we may do IV sedation, or we may do a certain kind of IV regional block where we numb up the area where we're going to be working. A lot of times for orthopedic procedures, you get a balanced technique of a combined spinal anesthetic along with IV sedation. If you're going to have a cesarean section, a C-section, More often than not, it'll be done as a spinal anesthetic. If you're starting with a labor epidural, that labor epidural may be converted to spinal anesthetic, where you're numb from the waist on down. And that will be done for orthopedic procedures before you actually even go into the operating room in most cases. We give you sedatives, so you may not even realize that we've done the spinal anesthetic, and you may not even realize you've gone into the operating room. The whole time during your procedure, though, you are constantly monitored. Your anesthesiologist will be with you the whole time. We also supervise nurse anesthetists. They're nurses trained to give anesthesia. They may be involved in your anesthetic care. Someone is with you the whole time that you're in the operating room. No matter what procedure you have done, you're going to have monitors on you. There are routine monitors. We look at your heartbeat, your breathing, and blood pressure. Every sedative, most sedatives, the side effect that we tend to worry about is respiratory depression. It can slow down your breathing. And the routine monitors will have a very excellent evaluation of how you're breathing and your blood pressure and during the procedure. We routinely give people oxygen. Normally, you don't have to breathe gas to make you sleepy. Exceptions are pediatric cases. Very small children sometimes we're able to do their anesthesia without even an IV. It's just inhalational gases. Not every person is going to get anesthetic gas. Not every person will get a spinal. Not every person will get various blocks that we can do, or IV regional blocks. Some orthopedic procedures, even though you're under general anesthesia, we may do a block of your extremity, either by a interscalene block, something that's going to numb up your shoulder area for orthopedics, or a block that will numb from the waist on down, either femoral nerve blocks or spinal blocks. That is done not only for intra-op pain, but also post-op pain control. So there's several different techniques that you might have. You may or may not realize any of the techniques that you've had. Your experience may be just that you had an IV started, that you were under sedation. Another patient concern they often have is post-op nausea and vomiting. That's our concern too. We routinely do things to try to prevent that, because even though you may have done very well hemodynamically, it can be spoiled by post-op nausea or post-op pain. We routinely will make sure that those issues are addressed. Nurses also have protocols where they will make sure that your pain is under control. We'd like to make sure that your pain and nausea is under good control and that we're doing our best to prevent that, or if it's not prevented completely, treat that. Other things to let you know about, the person who sees you in the pre-anesthesia clinic may not necessarily be the person that gives your anesthesia. We have at Meadville Medical Center 8 different anesthesiologists, and we also have 3 nurse anesthetists that we supervise. So the person who sees you may not be the one on the day of your procedure. Also, during your anesthetic, the person may change, your anesthesia provider may change in the middle of your procedure, but someone is always with you. Sometimes that's done for logistical reasons, like to give the person a break, a lunch break or something like that. After the procedure is done, you will typically go to recovery room or if you're outpatient center, back to the pre-op area. At that, they'll make sure that your vital signs are stable. They'll make sure that you're able to eat, drink, and void before you're discharged. I hope this answers any questions. If you have any problems, any questions at all, know that there's always an anesthesiologist available at Meadville Medical Center. We take call 24 hours a day, but we hope to get your anesthetic done in timely fashion so that you won't need to be here all day.